Guillain-Barre Syndrome is an autoimmune disease which is an acute, rapid, progressive, and potentially fatal syndrome in which the immune system attacks the peripheral nervous system, including in progressive muscle weakness that can lead to paralysis. The onset is unknown, but may be linked to Epstein-Barr virus and Campylobacter jejuni and other infectious diseases. Guillain-Barre Syndrome attacks nerves in peripheral nervous system, autonomic and cranial nerves. The damaged nerve cells causes ascending paralysis. This is a normal nerve cell, and it has its myelin sheath intact, and this is a damaged nerve cell, which shows demyelination. Three phases, if untreated, is acute, which begins with the first symptom and ending in 1 to 3 weeks. The plateau lasts several weeks. Recovery, being the final phase, coincides with remyelination and axonal process regrowth. Extends over 4 to 6 months and may take up to 3 years. It is possible for recovery to not reach completion. There are various forms of Guillain-Barre syndrome: acute inflammatory, demyelinating, polio-radioneuropathy, AIDP, being the most common in the United States. The CDC estimates 3,000 to 6,000 Americans develop GBS yearly on average. While it can strike anyone, it is most common in older adults and men over 50. Prior infection of Guillain-Barre syndrome to an immune response, segmented demyelination of peripheral nerves occur, preventing normal transmission of electrical impulses. The syndrome attacks the peripheral nerves so they can't transmit messages to the brain accurately. The myelin sheath degenerates for unknown reasons. The myelin sheath covers the nerve axons and conducts electrical impulses along the nerve pathway. With degeneration comes inflammation and patchy demyelination. As this disorder destroys myelin, the nodes of Ranvier widens, which are the junctures of the myelin sheath. This impedes and weakens impulses transmission along with the dorsal and ventral nerve roots. Clinical manifestations of Guillain-Barre syndrome is gradual block of sensation. We're going to use the mnemonic GBS to remember Guillain-Barre syndrome. Gradual block of sensation. The patient may experience sensations such as tingling and numbness in lower extremities that spread upward throughout the body, difficulty talking, chewing, and swallowing, loss of position of sense, weakness, diminished, absent, and deep tendon reflexes, tachycardia, and in some cases, bradycardia, facial flushing, urinary retention, poor respiratory effort, and decreased bowel sounds, immobility, and paralysis. Some testing that is done with Guillain-Barre is liver function test, creatinine serum levels, and erythrocyte sedimentation rate, which they may be elevated. Some diagnostic procedures that may be performed are cerebrospinal fluid analysis, which may show an abnormal white blood cell count, and severe diseases increase cerebral fluid pressure. Electromyography may exhibit repeated firing of the same motor unit instead of widespread sectional stimulation. Electroneuropathy shows prolonged T cells latency, initially conduction block, and marked showing of nerve conduction velocities. Complications of Guillain-Barre is paralysis. What it looks like, they can have facial paralysis due to Guillain-Barre. This is one exhibit of Guillain-Barre. On the A side, it's normal. He's just been diagnosed with Guillain-Barre. And on the B side, that's what it looks like. The face is kind of slouched, one side's kind of, and they can't move it. On the second exhibit, this is a good example of a Guillain-Barre also. They have permanent residual weakness, arrhythmias, urine retention, thrombophlebitis due to probably the IV transfusions that they're getting, pressure injury from immobility, contractures from immobility, muscle wasting, respiratory tract infection or failure, infection, blood clots, constipation, and cardiac compromise, and sometimes even death. For the patient to flourish, the nurse should offer treatment modalities within the nature of the disease. The nurse should offer emotional support. This disease can come on very quickly and may affect the client's mental status. Maintenance of skin integrity due to immobility is vital because the patient is putting pressure on one side of the body if proper turning is not implemented. Cardiac monitoring may be appropriate if the patient is experiencing arrhythmias and labile blood pressure. Occupational therapy and speech therapy may be implemented if the patient is having difficulty swallowing, chewing, or speaking. Physical therapy may be implemented for muscle strengthening and to prevent contractures. Medical treatments for Guillain-Barre are plasmapheresis and immunoglobulin therapy. Plasmapheresis is a machine that will filter blood to remove the antibodies from the plasma that are attacking the myelin sheath. This does not cure the disease, but helps in allaying the symptoms. Immunoglobulin therapy from a donor is given intravenously to the patient to stop the antibodies that are damaging the nerves. Lastly, and most importantly, it's crucial for the patient to receive proper nutrition during recovery and educated in nutrition. Nutrition can promote expeditious recovery in the patient. Guillain-Barre syndrome is a disorder that attacks the peripheral nervous system. It can affect anyone at any time, but the disease is more prominent in older and adult males. The onset is unknown, but may be linked to Epstein-Barr virus and Campylobacter jejuni. GBS can, however, be triggered in different viruses, including recent respiratory infections or stomach viruses. Experts are studying whether the outbreaks of the Zika virus in North Central and South America may be related to the simultaneous rise of GBS. While most people do recover from Guillain-Barre, it is common to have special rehabilitation to recover. Usually, if the onset of GBS is slower, recovery is quicker. If it is quicker, it's usually slower to recover. What is Guillain-Barre syndrome? Remember GBS. It is an autoimmune disease that attacks the body and causes a gradual block of sensation. During nurse report, you learn that the patient you will be caring for has GBS. As a nurse, you should know this disease tends to present with signs and symptoms will most likely start in lower extremities, be symmetrical, and will gradually spread upward. What is a laboratory test for GBS? ESR, liver, or creatinine test. What demographic does GBS most affect? Older and adult men over 50.